Over the last 24 hours, we have identified 1,738 new cases of COVID-19 in Alberta and completed about 21,000 new tests. Our provincial positivity rate remains high at about 8.3%, and we now have 20,161 active cases. There are 684 people in hospital, including 123 who have been admitted into the ICU. Sadly, there were 18 deaths related to COVID-19 reported to us in the past 24 hours. My sympathies go out to those mourning their loss. I know the current gathering restrictions continue to make it challenging for the family and friends of these individuals and for anyone who has lost a loved one to any cause to grieve in the ways that we are used to. Please reach out in other ways to those you know who are navigating a difficult time. In schools, there are currently active alerts or outbreaks in 458 schools, or about 19% of schools in the province. Currently, these schools have a combined total of 1,947 active cases. This number includes 293 schools with outbreaks, including 123 currently on the watch list. I know Albertans continue to watch these numbers closely, particularly for what it means for our acute care facilities. I want to share changes that Alberta Health Services is making to their designated support and visitation guideline. AHS has made the difficult decision to limit on-site designated support people in all acute care facilities. Effective Monday, access for designated support persons in AHS acute care settings will be limited to just one designated support person for each patient in ambulatory care, emergency departments, urgent care, maternity or postpartum, and other inpatient areas. Access will be limited to up to 2 designated support persons for each patient in critical care, pediatrics, and the neonatal intensive care unit. In many facilities, these new guidelines will mean little change from the regulations that are already in place. There are some exceptions and exemptions, so patients and families entering AHS facilities should contact the care team directly or visit ahs.ca/visitation before entering. We know these restrictions will be difficult, especially during the holiday season, but they are needed to stop spread of the virus and to keep patients safe. We must do everything possible to bend down the curve. There is no other option. Bending the curve is also why we have launched a new marketing campaign that uses humor to reach Albertans under 40 and anyone else who may have tuned out our other messaging. These ads feature a personified character representing COVID-19 at gatherings and in various other social situations. These ads were filmed last month under strict protocols to protect the safety of everyone present. The cast and crew were required to follow these strict protocols, including screening, off-camera masking, and distancing at all times when the camera wasn't rolling. Our goal is to get people's attention, to help them see common situations from a different perspective, and as a result, to influence their behavior. The campaign uses humor because the situation is serious, and we need to use every tool at our disposal to reach all Albertans. Lives depend on our ability to bend down the curve and reduce the spread of COVID-19. I want the families of the 684 Albertans we have lost to this virus and everyone currently fighting it to know that we are using every communication tool we have to help stop the spread. It's been a challenging week in our province, and it is easy to feel hopeless and powerless. But there is hope, and together we are powerful. We cannot change the number of new cases being reported today, and the cases we will see tomorrow are the result of how we behaved last week and the week before. But next week's numbers and the weeks after that are in our control. The future is up to all of us. I want to thank everyone who has embraced the province-wide mask mandate and restrictions on indoor and outdoor gatherings that went into effect on Tuesday. By following those measures, you are already helping to reduce the number of cases that we will see later this month. The other restrictions announced earlier this week for businesses and services will begin Saturday night at midnight. This is a deadline for implementation, but please consider what is possible to do before that to limit spread. I know owners, operators, and employees have been working hard to get ready for these changes, but we all need to start changing our behavior right now. We do not need to wait for the clock to strike midnight on Saturday and for those public health orders to go into effect to begin doing our part. This weekend, please do not rush into malls or cram into businesses tomorrow before the restrictions kick in. Don't host a holiday or Hanukkah party just because you don't think you'll get caught. Don't plan a family gathering just because you're pretty sure that your family doesn't have COVID. Every action we take is like throwing a stone into a lake. It ripples out, and we cannot know where those ripples will end. By altering our day-to-day actions immediately, we can reduce the number of new cases that we will see in the days and weeks ahead. It won't be easy. Nothing really is when it comes to this virus, but I know we can do it. In the spring and throughout the summer, we collectively kept our cases low and slowed the spread of COVID-19 in our province. Now is the time for us to do that again. We are in this together. Thank you, and I'm happy to take any questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Our first question comes from Dean Bennett of the Canadian Press. Your line is open.
Hi, Dr. Hinshaw. I'm just curious what your role was in the ad campaign. Did you have to sort of do final sign-off on it, given the messaging? And just wondering if you can tell us, if that's the case, what did you look at other options, maybe something more somber, and were there other options that you didn't have? Like, why'd you go with Mr. COVID Head? Did you go maybe with, you thought maybe having just one big COVID ball instead, or what was rejected, and what were the reasons you didn't go other directions?
We looked at a variety of options, and as you know, we have been working very hard, as I've said, over the past few months to think about what options we might have to reach out to Albertans, particularly in that 20 to 39-year-old age group, where we do see a large number of our cases. We know that Albertans in that age group are at the lowest personal risk of potentially having severe outcomes. However, they also, unfortunately, can spread the virus to others and be a part of that onward rising of the curve. And so we wanted to find an option that could effectively reach them. So I was part of the team that looked at various options that were really aimed at effectively reaching out to that particular age group, and again, others who may have tuned out the more serious and fact-based campaigns. We are continuing the serious and fact-based campaigns. Those have not stopped. But we felt that it was important to add an additional tool, again, to communicate more effectively to groups that may not have been taking our messages seriously, and to use humor, actually, to help them take the message more seriously.
Operator, could you put through the next caller, please?
Our next question comes from Jeff Black of 660 News. Your line is open.
Hi, Dr. Hinshaw. I also have a question related to the Mr. COVID ad. That commercial's just in an effort to spread awareness about the dangers of getting together this holiday season. But I'm wondering what steps the province are taking to curb the spread of misinformation about the virus, especially around the vaccine, which will be rolled out next week.
It's a great question, and we are working to make sure that information is available about COVID-19, about the seriousness of the infection, and also about the vaccine. So what we know about the vaccine, that the trials that have been completed to date on tens of thousands of participants of the Pfizer vaccine that's licensed in Canada now, that there have been that's demonstrated a 95% effectiveness, in those tens of thousands of people, and that the safety profile has been very good. We want to make sure that people have that information, and so we are working with multiple different groups to make sure that we provide that information in a form that they can then take and provide onto their communities. We'll make sure we have information available on our website, and working with Alberta Health Services to make sure, again, that they're able to use all of their channels to communicate accurate information. So again, this is about the vaccine, but it's also about that broader COVID-19 communications plan that we are constantly looking for that feedback loop so we can constantly improve and ensure that the information we're providing is reaching all Albertans in ways that help the message to sink in.
Operator, can you put through the next question, please?
The next question comes from Tanya Filbert of Rocky Mountain Outlook. Your line is open.
Thank you, Dr. Hinshaw. You have encouraged Albertans to engage in outdoor recreation as a way to maintain physical and mental wellness, even with the recent restrictions on outdoor gatherings. What direction have you provided municipalities with respect to managing outside recreational amenities like skating rinks? And why are outdoor group physical sport activities with a limit of 10 people still permitted?
We have been working with municipalities, and hopefully soon we'll have something available to provide some additional direction to those kinds of outdoor amenities like skating rinks, outdoor rinks that have a defined area. So that is underway. We want to make sure that Albertans have those opportunities to participate in outdoor recreation and outdoor sport, although, as you say, we have kept that limited to no more than 10 people. And the intention for that is we know that people who participate even in something as simple as an outdoor run or an outdoor walk, if they're not able to do that with a household member for various reasons, then they may not be able to do it at all for safety reasons unless they can do that with someone outside their household. So we wanted to be sure that we were not limiting people's ability to have those outdoor recreation, outdoor fitness opportunities. But of course, the expectation is that people will remain distanced while they're participating in those outdoor recreation or fitness activities, and that if they can keep it limited to under 10, that they will do so. So the important piece, again, is to make sure that all of the appropriate measures are in place, even when participating in an outdoor fitness activity.
Operator, could you put through the next question, please?
Our next question comes from James Keller of the Globe and Mail. Your line is open.
Hi, Dr. Hinshaw. Earlier this week, the Premier indicated that you would be coming out with some sort of recommendations for people who insisted on hosting family gatherings at Christmas, for example, with some sort of period of quarantine beforehand. Is that happening? And if so, where is that at? And how wise do you think it would be for people to gather at Christmas after taking steps like these in spite of the prohibition on social gatherings?
We did discuss that within the team and looked at various options. And as you may know, other countries, other locations, so one example is Germany, have looked at options like that, where they are indicating that if people want to gather, then they have to complete a quarantine before that. One of the challenges as we were considering potentially using that option is that our case numbers are very high and we are very close to Christmas. The chances that people could become infected at a family gathering are quite high, and the timeline to be able to plan for that, very, very strict quarantine that would be required, is very short. And the final piece is that people may interpret that quarantine plan differently, and really we feel right now that the risks are very high, that social gatherings are, again, one of the most significant forums for causing spread. And so it was my recommendation that we continue with our current framework, which is to say that while we know it's extremely difficult, it is important that Albertans celebrate holidays this year with their immediate family of their household only, and those who live alone may then, of course, have up to 2 other people with whom they can celebrate.
Operator, can you put through the next question, please?
Our next question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. The Premier said a COVID-19 vaccine will not be made mandatory. However, we know community transmission has been pinpointed as the culprit for cases in healthcare settings and congregate care facilities. Under your authority, will all healthcare staff and those who work in congregate care be required to be vaccinated? And will Alberta require something like a vaccine passport, where people need to show proof of vaccination before they use certain services or before they enter certain businesses or health facilities?
The recommendations of the National Advisory Committee on Immunization are that at the beginning of our vaccination campaign, because at the moment we don't yet know exactly how long immunity will last, we don't know specifically, again, with a vaccine that's 95% effective, there is that 5% for whom it may not offer complete protection, that the kinds of measures that are in place right now, especially in the first couple of months as we're still learning about the vaccine, public health measures will need to stay in place even for individuals who've received the vaccine. Vaccination will not be mandatory. It is a choice of an individual to receive the vaccine. So the priority groups that we've described are the groups that will be eligible, should they choose to do so, to receive the vaccine. And again, we are going to be, of course, learning more, monitoring very closely the ongoing information about the long-lasting nature, how long that vaccine effectiveness lasts. And also, of course, we know that in the first tens of thousands, over 40,000 doses that were administered, there were no serious adverse events reported. But the vaccine safety is an incredibly important thing that we're going to be monitoring for. And so we want to make sure that all of that information is available to people as they make these decisions about whether or not to take the vaccine.
Operator, we've got time for 3 more. Could you put through the next caller, please?
Our next question comes from Jason Herring of Post Media. Your line is open.
Good afternoon, Dr. Hinshaw. The contact tracing system in Alberta has been broken since November 5th now, and I know last week Alberta announced the province would double its contact tracing capabilities by the end of the month. I'm just wondering if you have an update on how that process is going and whether you have a timeline on when contact tracing will be functional again.
The details on exactly how many contact tracers have been hired, what our current specific FTE numbers are, would be available from Alberta Health Services. What I can tell you is, as was discussed previously, we anticipate that the system will be moving up to capacity to be able to reach all of the cases and complete contact tracing, as you say, by the end of the month. It is important that we work together to make that happen. So there are 2 things we need from Albertans. The first thing we need is for people to follow the current measures, to be able to bend our curve and keep our numbers low. Because even if we could contact trace every single case right now, our numbers are too high right now and causing an impact on our health system. So we need to bend that curve down. The second thing we need from Albertans is, when they are contacted, somebody who is diagnosed with COVID-19 or identified as a close contact of a case, we really need people to work with those contact tracers and case investigators to provide the information that's necessary to protect their friends and family and communities, because the more that we work together, the more effective we'll be.
Operator, could you put through our second last question, please?
Our second last question comes from Rafi Boudjikanian of CBC. Your line is open.
Hi, thanks for taking my question. Dr. Hinshaw, between, all these new public health restrictions and our really high case numbers, I think it's no secret that we're in a much worse place than we were in August. In fact, we've got 15 times the increase in cases in Alberta as we did than when the NHL bubble started. Half of the 20,000 cases, almost half, are in Edmonton. 72 people here are in intensive care. And we know there have been COVID outbreaks amongst some of the arriving teams from the World Juniors, and they start arriving in 2 days. I'm wondering, under all these circumstances, how safe is it to host the World Juniors right now?
What we know about the NHL tournament that happened in the summer is that the protocols that were in place effectively separated the players from the surrounding community. As you know, we didn't see cases in those player groups, and the protocols that are being used for the World Juniors are modeled after what happened with the NHL that was very successful. It will be critical, and it's one of the main goals of my office, to ensure that any arriving teams do not pose a risk to the general public. And we're wanting to make sure that those protocols are followed. We have been working closely with the organizers to make sure that those protocols are robust, that they are being followed exactly as they are laid out. And again, it's my job to make sure that this does not pose any risk to the public, and I'm confident that that is the case.
Operator, can you put through our final question, please?
Our final question for today is Matt Woodman of CTV. Your line is open.
Hi, Dr. Hinshaw. I've got two questions. My first one, I'm just wondering, for the 55,000 Albertans who have had COVID and have since recovered, what does this vaccine mean to them? Is there any point in getting immunized, or would it not be effective? And my second question is, we're hearing from some funeral home workers who say they're disappointed they're not being considered for the first wave of vaccinations. They feel like they're frontline workers, considering they have to go into hospitals, long-term care homes. So what are your thoughts on this view, and do you think the government would reconsider vaccinating them amongst frontline healthcare workers and long-term care home residents?
The first question about what the vaccine means for those who've already been infected with COVID-19 is that, again, we're still learning about the vaccine. We're still learning about what kind of immunity people might have if they've been infected, how long that might last. At the moment, there's no evidence that receiving a vaccine after someone's been infected is harmful in any way. There's no evidence that that is a risk to individuals. At this time, we are focusing on those who've not previously been infected. However, again, there's no evidence of harm, and ultimately there's no contraindication to somebody who has had the virus in the past from receiving a vaccine. And in fact, it may be beneficial in terms of boosting or adding to any immunity that an individual has acquired through infection. Again, we don't know for sure how robust natural infection immunity is or how long it lasts. The second question about funeral home workers, there are many Albertans who we know are performing critically important services, and many Albertans who we know will benefit from the vaccine when we have enough doses that are available. What we have looked at as we've prioritized the vaccine is, in this very first round of administration, we're looking at two things. The first thing is those who are most at risk of severe outcomes and death from COVID-19, and that would be those residents who live in long-term care and designated supportive living facilities, and those people who work with those individuals, because they are potentially sources of infection for those individuals who live in those facilities. So that is a critically high risk group. And the second group is those healthcare workers who are in critically short supply, where we know we're seeing a lot of pressure in the system. So for example, respiratory therapists, intensive care physicians, and other healthcare workers in intensive care, because that is exactly where this significant pressure in our system is right now. So those priority groups were chosen based on, again, those at highest risk of severe outcomes, those who are going to be able to protect those at risk, and then those who are in very, very short supply with respect to that healthcare pressure. So funeral home workers, I think we're being asked about other priority groups, such as law enforcement, such as other. And there are many, many groups, again, who provide critical services and who will be considered in subsequent prioritization of the vaccine.
Thank you all for joining us today. Have a very safe weekend.